Jen, this does not feel like a traditional med spa.
Well, thank you for saying that. I actually built the med spa with the intent to do it different. The main focus of Pure Skin has been really serving with intention and integrity, and education being at the forefront of what we do. I found that in this industry, there was a lot of overselling and under-delivering. My position here is really not so much as a provider as I am a patient care coordinator. And in that role, my main job is to meet with all of our clients for that initial complimentary consultation. It's really to get to know you, find out what things you've done in the past, what did you like, what did you dislike, what are your goals that are bringing you in today. The idea 8 years ago when I started the business was that we were replacing like with like, and that we were not just a Botox filler center. We were talking about skin health, which is what I started it on, and talking about how do we stimulate collagen at every level of the tissue, which is a more natural approach to skin. I'm gonna take your aura. You ready? So this is aura skin analysis. There's 13 cameras in here. It's gonna take those 13 pictures and put together into one. So this aura is really cool. Let's go back over here to the raw picture. And what I love to show people in this picture is, like I said, this is 13 cameras that took one picture, made a 3D twin of you. So this aura is really nice. I think today the girls are going to do some lower face talks on you. So as we age, the corners of our lips come down.
Brittany, talk to me about the popular injectables.
We've got Renuva, which is a fat stimulator. We have Sculptra, which is a collagen stimulator. And then we also have Radiesse.
Are there different types of talks?
We have Zeman, Botox, which is your brand name. We also have Dysport, Daxify, and Jeuveau. So they essentially all do the same thing. However, we choose the product based on age, demographics, medications that they're on.
Dr. Faith, how do you create a more natural look using injectables?
So our focus here is really on bioregenerative aesthetics. And what that means is we use different products to stimulate your body's own tissue replacement of what it's losing with aging. A lot of my favorite bioregeneratives that we have here, one being Sculptra. Sculptra is actually a collagen stimulator. That is kind of like my bread and butter treatment. I've trained with the top Sculptra provider in the world, and I actually have a really great technique. And what that does is it really stimulates collagen, but it helps imitate the bone loss and fat loss we get with aging. My patients absolutely love it, and it keeps them looking young decade after decade. And then for anything that the Sculptra can't cover, we have an amazing product called Renuva that actually causes fat stimulation. So we're getting collagen stimulation with the Sculptra. We can get fat stimulation with that Renuva. It gives an amazing, beautiful plump to the cheek without making you look full. It's so natural, and the combination of Sculptra and Renuva are my absolute favorites.
There's a lot of stigma around fillers. Do you use fillers?
There are just certain areas bioregeneratives can't go and don't do an amazing job at. And in that case, I will reach for a filler and use it very mildly in terms of amount and place it very strategically. There is a beautiful art with filler. I love filler in certain areas of the face, and it can be done very naturally.
So our approach here at Pure Skin is taking regenerative medicine and using that to our benefit for the patient to create the most natural, long-lasting result. So in your case, we started with regenerative medicine. We use Sculptra. Now you're still a little bit flat in your mid-face here. So what we're gonna do today is we're gonna take some filler, HA filler, and we're gonna place some filler in a couple different spots just to give you a little bit more volume, because we love pairing regenerative medicine with our fillers. We have a product called PDGF, platelet-derived growth factor, and we use this product to rejuvenate the skin on the forehead, around the mouth, and we also use it under eyes.
Then the second division that I added to Pure Skin was our wellness department. And our wellness department is where we do bioidentical hormone replacement therapy, peptides, IVs, sexual health.
Let's talk about hormone replacement.
Shall we?
Yes.
At Pearskin, we try to match your outsides to your insides and insides to your outsides. So we want to make sure that while we're making you beautiful from the outside, we're also addressing the causes from within that can either help or hurt us. That's where hormones and peptides come into play.
How early can you start using peptides and start doing the hormone replacement?
I get asked this question a lot. You can really start at any point where you're feeling just not like yourself. And for some women, that's as early as 35.
Wow.
Yeah. But you'll be in perimenopause for at least 10 years.
That goes on for 10 years?
It can, yeah.
Let's say a 40-year-old woman comes in. How would you determine what she needs?
Symptoms are important. What you're experiencing is important. I also start with lab work.
What if the lab work is not showing how the patient is feeling?
Sometimes it doesn't tell the full picture. My doctor says that I should be normal because my labs are normal, but they don't. They don't feel that way. And that's the frustration that I think most women and men have.
Let's talk a little bit more about peptides.
Peptides are a great addition to bioidentical therapy, even as a solo service. Peptides are short amino acid chains that direct the body to do something. We can either tell it to lose weight, build muscle. Peptides can do a lot.
How long do you have to stay on these peptides?
For as long as you need them. We've been dabbling in peptides for as long as we've been open. And the more information, the more research, and the more you practice medicine, you realize how useful they can be.
We also have All Therapy, which is a ultrasound device that uses high intensity frequency ultrasound to stimulate collagen at the deepest levels of your face. And then we also have what I call energy-based devices and lasers. Not everything that's a device is a laser. So we definitely do a lot of broadband light, known as BBL. We do a lot of Moxie.
I have a big background in different types of laser treatments. The lasers have different degrees of aggressiveness, and it really is dependent on how much downtime you have at the moment. And so we have to tailor the treatments to that, to their schedule, because you can really see the difference if I can let that laser do what it can really do. Ultimately, I want people to leave here feeling great, but feeling that they got the best care possible.
So in our skin health division, we're gonna have facials, chemical peels, different forms of microneedling.
So exciting as an esthetician that I actually have boosters that I can affect change in people's skin.
How important is it to get your skin prepped before injectables and lasers?
But the more prep you do, the better result you're going to have in the end. So if we can do a peel on you before you have a BBL, then you're going to have a better result. You're going to get more pull. Facials once a month, I feel like, are really important because we can check in on your skin. You know, your skin is going to change if you have something done, if you have some sort of energy. So I want to stay on top of that.
At Pure Skin, from the moment you walk in the door, we are really committed to capturing that very first photo of you before you came here. Sometimes people don't see the magic, and then we show you that before and after photo, and you're like, wow. You forget what you looked like and you have an aha moment.
Jen, I just want to say thank you. I've been to other med spas and I know this is not your typical med spa. I felt like they never listened to my concerns, and I feel that you did.
Thank you so much. That really makes me feel great because that means that my team and I have accomplished what I set out to do when I started 8 years ago. I've built this business predominantly on referrals, and I hope that we'll continue to do that.
Well, you have a customer here for life.
I love that.